Hello everyone and welcome back to our channel. Today we're discussing a serious but rare neurological condition called Acute Flaccid Myelitis, or AFM. It's a condition that can be frightening for parents and individuals alike, so our goal today is to shed some light on what it is, its symptoms, and how it's managed. So, what exactly is acute flaccid myelitis? Think of it as a sudden attack on the nervous system, specifically affecting an area of the spinal cord called the gray matter. This part of your spinal cord is crucial for controlling muscles. When it gets inflamed or damaged, it causes the muscles and reflexes in the body to become weak. AFM is not new, but we've seen an increase in cases since 2014, often appearing in small outbreaks. It primarily affects young children, but adults can get it too. It's important to remember that AFM is very rare. The chances of you or your child developing it are less than 1 in a million. Now let's talk about the symptoms. The most defining symptom of AFM is the sudden onset of arm or leg weakness. This can happen over a few hours or a few days. Along with this weakness, you might notice a loss of muscle tone and decreased reflexes. It's not always symmetrical. One arm or leg might be more affected than the other. Some people also experience other neurological symptoms. This can include facial droop or weakness, difficulty moving the eyes, drooping eyelids, or trouble with swallowing or slurred speech. Pain is another common symptom, often in the arms, legs, neck, or back. Sometimes, before these neurological symptoms appear, the person might have had a respiratory illness or fever, similar to a common cold. The most serious symptom, though rare, is respiratory failure. This happens if the muscles that control breathing become weak. This is a medical emergency. This brings us to a crucial point: when to see a doctor. If you or your child experiences any sudden weakness in the arms or legs, facial droop, or difficulty swallowing or breathing, you need to seek immediate medical care. Don't wait to see if it gets better on its own. AFM progresses quickly, and early medical intervention is key to managing the condition and preventing serious complications. Think of it this way: any sudden onset of paralysis or significant weakness is a red flag symptom that warrants a trip to the emergency room. So what causes this rare condition? Is this rare? This is a question researchers are working hard to answer definitively. The leading theory points to viruses. Specifically, enteroviruses like EVD68 are strongly suspected to be a major cause. These are common viruses that usually cause mild respiratory illness, like a cold. Why a common virus would cause such a severe neurological condition in a very small number of people is still being investigated. It's thought that in these rare cases, the body's immune response to the virus might go awry and attack the spinal cord, or the virus itself might directly damage it. Other viruses, including West Nile virus, have also been linked to conditions similar to AFM. It's important to know that despite the viral link, there is no evidence that AFM is contagious. You can't catch AFM from someone who has it. Let's discuss the potential complications. The severity of AFM can vary greatly from person to person. For some, the weakness might be relatively mild and improve over time. For others, it can lead to long-term significant paralysis. The long-term outlook really depends on the extent of the damage to the spinal cord. Some individuals may require ongoing physical and occupational therapy to regain strength and function. In the most severe cases, the weakness can affect the breathing muscles, leading to respiratory failure. This requires hospitalization and often support from a ventilator to help with breathing. Living with long-term disability can also have a significant emotional and psychological impact, both on the individual and their family. Are there specific risk factors? Because the exact cause isn't fully understood, it's hard to pinpoint definitive risk factors. However, based on the patterns we've seen, the biggest risk factor appears to be age. The majority of AFM cases occur in young children. Also, having a recent viral infection, particularly a respiratory one, seems to precede many cases of AFM. Since enteroviruses are thought to be a primary trigger, Exposure to these common viruses could be considered a risk factor. But remember, millions of people get these viruses every year with no issue. It's the rare, severe reaction that leads to AFM. So how do doctors diagnose AFM? There isn't a single test for it. The diagnosis is made by looking at a combination of factors. It starts with a thorough neurological exam to assess muscle weakness, tone, and reflexes. The doctor will also ask about recent illnesses. The next crucial step is an MRI of the brain and spinal cord. In AFM, the MRI will typically show specific abnormalities in the gray matter of the spinal cord. Doctors will also likely perform a lumbar puncture, also known as a spinal tap. This involves collecting a small sample of cerebrospinal fluid, the fluid that surrounds the brain and spinal cord. They test this fluid for signs of inflammation, like an increased white blood cell count, and to look for viruses. Nerve conduction studies and electromyography, EMG, might also be used to measure how well the nerves and muscles are working. Once a diagnosis is made, what's the treatment? Currently, there is no specific cure or targeted treatment for AFM. Treatment is focused on supportive care and managing the symptoms. This often involves a team of specialists, including neurologists, infectious disease experts, and rehabilitation specialists. For severe cases with breathing difficulties, mechanical ventilation is essential. Some doctors may try various treatments like steroids or intravenous immunoglobulin, IVIG, which is a therapy using antibodies, but their effectiveness for AFM is still unproven and under study. The most important and proven part of treatment is rehabilitation. Early and intensive physical and occupational therapy is critical. The goal of therapy is to help the brain and nerves rewire and to maintain muscle strength and flexibility, helping patients regain as much function as possible. What about alternative medicine? When facing a serious diagnosis with no cure, it's natural for people to explore all options. However, for AFM, there are no proven alternative therapies that can treat the underlying condition. While things like massage or acupuncture might help with pain or muscle stiffness as part of a broader comfort plan, they are not a substitute for conventional medical care and rehabilitation. It is absolutely essential to work with your medical team and follow their guidance. Be very wary of anyone promising a miracle cure for AFM, as these claims are not supported by scientific evidence and can be dangerous. Finally, let's touch on lifestyle and home remedies. The journey with AFM continues long after leaving the hospital. The focus at home is on continuing the hard work of rehabilitation. This means diligently following the exercise program designed by physical and occupational therapists. This is crucial for maximizing recovery. Adaptive equipment, like braces or wheelchairs, may be needed to help with mobility and daily activities. Living with a long-term condition can be emotionally challenging, so support systems are vital. This includes family, friends, and mental health professionals. Connecting with other families affected by AFM through support groups can also be incredibly helpful, providing a sense of community and shared experience. And remember, basic hygiene practices like frequent hand washing are always a good idea to help prevent the spread of viruses that could potentially trigger AFM. AFM is a complex and challenging condition, but research is ongoing, and the medical community is working hard to find answers. We hope this overview has been informative and helpful. Thank you so much for watching. If you found this video valuable, please give it a thumbs up, and don't forget to subscribe to our channel for more health content. Stay safe, and we'll see you in the next video.